Hello, everyone, and welcome to this episode of the Biometrics Leadership Lab. Here at the Leadership Lab, we are supporting you on your biometrics journey, giving you the tools and knowledge you need to grow from lead to leader. And today we are talking about my number one most requested topic, R. Thank you for joining us live, and if you are watching a replay, thank you for taking the time to catch up. You can ask questions during the broadcast on the event notice on LinkedIn, and we'll see them. However, we can't respond in writing while we're live. So if we don't get your question while we're talking, we will answer it after the event, either in the comments or in an upcoming newsletter edition. Before we get started, we're just going to do some quick introductions. I am Amanda Cross, founder of Crossfield Coaching and Consulting, an executive biometrics consulting agency dedicated to helping small to mid-sized companies and teams deliver biometrics in a better way. With decades of experience in clinical research, from statistician to chief operating officer, I leverage my cross-functional expertise and training to help teams integrate, communicate, and collaborate to improve their service delivery. I also help functional leaders professionally develop themselves and their teams. Sunil, would you like to introduce yourself?
Sure. Thank you, Amanda, for inviting me to be a speaker. My name is Sunil Gupta. I've been in the pharmaceutical industry for about 3 decades, so very much hands-on experience working with top sponsors, top CROs, SaaS expert, and then I also teach CDISC and SaaS through UCSD. For the past 3 years, I've been teaching R as I've seen the growth and the need for R in the pharmaceutical industry. So I've been learning and doing more about that. So very excited to be here.
Great, thank you so much. Before we get started, I just want to note that this discussion is only scratching the surface of R and is not going to tell you everything you need to know to integrate R into your workflows or to become an R expert. If you want to know more about working with R, Sunil is the guy to communicate with, and it will include his contact information in upcoming newsletters so that you will be able to reach out to him directly. We are going to start with a brief history of R, which was helpful for me. R originated in the early 1990s as an open source programming language inspired by S, if anybody happens to remember S, and it was developed by Ross Ihaka and Robert Gentleman at the University of Auckland. It gained traction in academia and statistics due to its flexibility and powerful visualization capabilities. And even now, I find that most people, even if they know very little about R, including me, know that R is much better than SAS for visualization and graphing. The Comprehensive R Archive Network, or CRAN, launched in 1997, providing a repository for packages that expanded R's capabilities. Over time, R has grown into a dominant language in data science and analytics, widely adopted in various industries, including finance and bioinformatics. There are currently over 22,000 R packages, ranging from clinical trial simulations to fun stuff like using cat pictures on plots. Currently, R is licensed under the GNU General Public License, and it is written primarily in C, Fortran, if you happen to remember Fortran, and R itself. In pharmaceutical research, R has gained visibility in recent years as regulatory agencies such as FDA have begun accepting its use in submissions, provided it's properly validated. SAS remains the dominant tool for clinical trial analysis and reporting, and some pharmaceutical companies are integrating R into their workflows, with Novartis, Roche, and others using R and contributing to the open source efforts. There are some helpful webinars out there about companies using R in submissions, and I will link to those in an upcoming edition of my newsletter. And with that, we're going to jump into the Q&A on R. And the first topics we're going to cover consider R in the role of clinical research. So Sunil, how has R's role evolved in clinical research over the past decade?
Yeah, I think this is a very important. R started off really as purely data science, and but now it's really getting into the more the clinical and the pharmaceutical area. As you mentioned, R has really gained traction in graphs. So I think data visualization is really getting a good hold on what people can do with R, much easier. The alternative, of course, with the SAS, you have the ODS and the graphical template language. But with R's role, you see the growing use of Pharmaverse. And so Tidyverse has been there, has been a very well established way of doing programming in R, many things that it's possible. And then Farmerverse comes along with the complete collaboration. And so with the Farmerverse, you're opening up a whole new set of windows, that including our Shiny, but it really opens up with a lot of things that extends what has been previously been done in our field, can now do a little bit more with R because now you have so much collaboration.
So, what do you think that programming teams and biometric teams are primarily using R for today? What types of analysis or reporting?
Yeah. So the nice thing about R is you can take baby steps to do some minor things like doing some data quality checks. Those are definitely possible there. You can bring, one of the things that I encourage organizations to do is get a good feel for the data in R. So import your SAS data sets into R. So you can learn and feel what you can do as far as graphics with R, as we've mentioned before. Because the nice thing about this about R is, these functions, these packages are custom made to present the analysis that you want. But not only that, you can use, as I mentioned, many of the packages within the Farmerverse. So you don't have to invest into developing programs to create STTMs, for example. There are packages that are there to create STTMs to create the atoms. So you have the oak, you have the admiral, and so organizations are realizing that not necessarily for doing source programming, but you can also use that for QC purpose as well. And so the nice thing about the way you have R is, depending on what your initial goals are, you can start off very small, or you can start off, with big plans to incorporate R in many of the clinical data processing flowcharts that you have.
Okay, so I've heard you mention a lot of different packages and a lot of different universes. So let's see, I'll throw some names out there and see if you can help us quantify how these all fit together. I've heard you mention the Tidyverse. I've heard you mention the Pharmaverse. You've mentioned Oak, Admiral. I know there's our Shiny, our Studio. What are all these things and how do they fit into the world of our?
Yeah, good question. And I want to state that many of these questions are exactly the same type of questions that I had when I started learning R, because I'm as a seasonal programmer in this field. I'm always comparing it to SAS. This is what I've done with SAS. So how does it compare? And so all these questions are very, very relevant. Everybody goes through the same type of process. So basically, it can get very overwhelming. As everybody knows, R is open source. There's advantages and disadvantages to that. The real disadvantage I see is that, pretty much, well, any person, any organization could develop R packages. And there's a process in order to do that. These packages are specific, do a specific type of function. And so once those packages become available, anybody could actually download and use those packages. So the popularity of some of these packages, as I mentioned, the tidyverse, what happens is with over time, with evolution, you have a community of our programmers, and they do common things: data import, data management, data analysis. And so what happens is tidyverse is like the best of the R packages, mainly because you have the best ways of bringing data into R, doing data manipulation, data management. And so tidyverse is the collection of those best R packages that enable the R programs to be functional. And then what we do is, then we have the Farmerverse, which is complete collaboration within the pharmaceutical industry, does very much similar things to as far as the Tidyverse, but think of it specifically in a clinical process flow where you have end-to-end and specific things that you need in our pharmaceutical industry that have been developed. So you have packages that were developed by sponsors, CROs, complete collaboration. And keep in mind that these packages, they're again, go back to SAS. So I've been a SAS developer, so I've developed SAS macros. And I think SAS macros is a good comparison because SAS macros really require like 10 to 20 times more time for validation, documentation, testing than do SAS programs. Why? Because those macros have to be extremely robust. They have a collection of parameters. Those parameters need to be thoroughly tested. They could be defaults. So packages are very similar to that. And so I think, you know, Now, people need to realize that, okay, there's thousands of packages out there, but start work with the most common ones and then get familiar with that. Once you learn how one package works, the functions within there, then you can apply that knowledge for other packages. Um, so hope that answers some of those questions as far as the packages.
So what is our Shiny and our Studio?
Yeah, so our studio, so first you need to have R installed, so that's base R. The R Studio basically enables a good GUI interface. So keep in mind that R is a very, is I think it's more technically statistical language, syntax based than SAS. Um, and so because of that, you're really working with objects, and objects, as you know, can be very abstract. And so you need to have some way to quantify. In SAS, we had the display manager, we had what is it, statistical computing guide. And so our studio basically enables a good user interface to write your code, to see the log, to see the objects that are created. And so you need that type of environment to be extremely productive. And then our Shiny basically is an extension. So our Shiny is considered like dashboards that you have. So anything that you develop within R, you can extend that into an R Shiny app. And the nice thing about that is it enables more engagement with the users, with the team. So you have more interaction with the data, and that means you can select maybe specific domains, variables, conditions visually, and then values. So now R Shiny does require a little bit more of a learning curve after learning R, but it is a great next level step to make use of things that you developed in R.
Okay, thank you. We're going to jump to a group of questions I've categorized under regulatory considerations and validation. What do you think are some of the biggest challenges in validating R for clinical trials and regulatory submissions?
Yeah, and again, these are really good questions. I think that having a master plan, you don't want to always get the latest version of these R packages. Keep in mind that it's like a moving target, and you have dependencies on these packages. So one package could depend on another package, so it could be administrative type nightmare, and that's why I encourage my clients and students to partner with experts who've gone through this process. So the validation will be, identifying specific packages, the versions that you want, understanding the dependencies of those packages, and then just like in SAS, do installation, operational qualifications so that you know the outcomes of when you install these packages, what the expected results are going to be. And so those need to be done. And just like in SAS, you have a development, you have a production environment. So only in the production environment would be the packages that have been completely validated. And keep in mind that we're not talking tens of packages. We're probably talking about hundreds of packages. And so versus one SAS, you have a SAS version, you have the SAS module. So it's very more SAS is much easier to, I think, validate because it's more structured, whereas R is more open-ended. But that doesn't mean that you can still apply good validation. It requires more documentation. So there is some challenges, but I think that if you go through the process and follow the software development lifecycle, and then the documentation, and then controlling access as well as audit and version control.
So this is just a new question that we hadn't talked about before today. It's just coming up because I always think about making a comparison back to SAS just because it's a world in which we're all familiar with. And SAS has versions, right? It's version controlled. We've got, some of us have been using SAS since back in version 3 or 4. And, but you have 9.1, 9.2, 10.2. And it's all very clear when you're uploading that. And that's one package. And so then if you think about R, and it's very easy to think, oh, it's open source and it could be changing every day. Like it's probably not doing that, but like that's your worst fear in using it in a regulated environment. So Is it that all of these different packages are somewhat version controlled, and then you just make a decision on which version you're going to bring in house and validate?
Exactly. That's what it boils down to. As you mentioned, the CRAN is there for people to download, and people are downloading, are on a regular basis, and the packages on a regular basis. But they're also realizing that they don't need to always download that package. Now, the way that R works is once you download, install the package, you don't need to do that again. You just need to load it within your R session. So you have that fixed R version load in your R session, and then you can actually utilize the functions within there. But yeah, that's correct. There are the other thing also I like to mention about this because this is a very important topic. There are actually packages that help you monitor the risks associated with an R package. So, which is really great because things that you're really looking at and that it tells you like the number of downloads that are there, number of updates that are made. So if a package is widely being used and it has minimum maintenance and is very stable, then you know that people rely on that type of package, and I think organizations can do that, and that's what happened with tidyverse. It was before tidyverse, it was more of a wild west, and then our the people at our studio, our project realized, okay, let's have some structure, some organization, and for building packages on top of other packages, which can complex things. And SaaS doesn't work that way. So when you have that, then it's a good to have some governance, some rules, and Tidyverse is a great way to encapsulate the control of the collection of packages working in sync together. And so I think that and that's why you need to have, I think more of experts who've gone through this process to realize, okay, there are some packages that help manage the packages and the version controls of that. And you also hear mention of GitHub, which is again a repository for helping the version control management.
Okay. Are there any frameworks or best practices for validating our scripts in a GXP environment?
Yeah, so I think that again, following things that we've talked about, I always want to always incorporate good programming practices. So that means setting up a setup file, directory structure, naming convention. You also organizations still can follow their SOPs. So the SOPs for the development of programs, for the validation of programs. Now ours just a software, just like SaaS is, and so people need to realize that okay, once R is in a production environment, and you also need to have people who are knowledgeable about R who can do the programming. You don't want to be writing code that's not going to work. You want to, if you're going to be using R, for example, for QC purpose, then you want to be able to produce, for example, the data sets, and you want to be able to have some way to do the comparison. So I think, for the 21 CFR Part 11, you want to, make sure that people only having authorization and access to the data is there who can work with the data, do the programming correctly, have the expertise, because everything that has been done in SaaS, you're just kind of replicating that now in R, which takes a little bit more administrative process.
Okay, and then this is probably a basic question, but I'm asking it because I played around with R once, and we'll talk about what it's like to program in R in a little bit. But we think about going back to SaaS. We write our code and we save it in a .sas file, right? So you've got our executable code. I assume you're doing something similar in R, even if you're using R Studio as your interface to your program development, you can save that code in a similar way.
Yeah, exactly. Now we're getting into a little bit of the semantics here. One of the things that I have to say that is a little bit surprising is R is case sensitive. So what that means is references that you have to data frames, to variables, even for the R functions themselves are case sensitive. And so you have to be very careful. So the exact same function name will not work if it's not in the proper case. But basically, that is correct. in your R Studio, you would write your R program. You follow the same type of logic as far as bringing data in. And I was happy as I was learning R. I wanted to see, okay, how can I do SQL type processing, because that's all very important. So I was able to realize that. Um, R itself is a collection of functions. And that's great, but in our programming environment, we actually want to unite functions together. We don't want like individual processes. And so, fortunately, there's a what's called a piping. And so, what that means is you can pipe the output of one function into another function, and that enables us to more streamline the process flow. So you have functions after functions that are being executed in order to accomplish a given task. So in that sense, it's a little bit different. In SAS, we have the data steps, so we have the procedures and all that stuff. In R, because it's a world of functions, and keep in mind, these functions are, there are like SAS functions that we know of, which is very straightforward, can process one or more variables, but they're really along the lines of SAS macro programs. And so I always kind of relate to that and say people that R functions are really SAS macro programs. So what does that mean? SAS macro programs are called, and you have parameters, so they have some expectations that are there. And so within the R script, you have a sequence of R functions there, but they're streamlined so that it works together as a unit. And so that's interesting concept that people need to learn as they're doing programming in R.
All right, thank you for that. So we're going to talk a little bit about just some practical adoption and what that really looks like. And so before we dive too deep into that, though, what advantages does R have over SAS, if you think about it from the perspective of a programming team?
Yeah, I think, I think that R is very unique in that I think it's truly an object-oriented programming language. Um, the syntax that's there in R, there's more meaning. So you have brackets, you have dollar signs, that has specific meaning there in R. In SAS, it's not really there. But in R, so what that means is you have what's, data frame options. So very similar to data set options that we have in SAS. In R, you have data frame options, and that can be applied anywhere. So you can do any type of querying of your data, and so that's extremely powerful. So and the R, you have a lot of nested functions, and so you have to realize this is how you can get things done in R. You have nested functions. So R is also very designed for creating dummy data. So dummy data is there, very easily possible to be done with R. The other advantages that are there with R, obviously we've seen, graphics that's there, because R is open source. You have so much collaboration going on. So if you have statisticians, there's specifically needs for statistical type of modeling procedure that may not be there in SAS. They could see that if it's actually available in R, then there's some advantages going to use that. Um, there are some differences that are there with between SAS and R that also needs to be understood. But I think that you see that with R, you know, there are many advantages as we have seen again with the Farmerverse. So you can actually leverage uh, things that have been developed outside of your organization in order to get a good jump start. So going through the learning curve of R, I think will be very beneficial because it opens up a whole new world of things that are available that you can leverage. And I haven't even mentioned like R galleries. So you can actually take a look at graphs that have been produced and then use those packages, use those functions. It's just basically like a SAS macro call away. So you can kind of think of it that way.
So this R gallery, because it's not something I haven't heard of, is that like you could see examples of what these graphs look like, and then you could go and choose the one that you want to represent your data?
Exactly, exactly. So as you see, I've developed my website, R Guru, based on the model that I've had with SaaSavvy.com. And so I want to enable, productivity. And so I see these galleries that are there. These galleries could be, for example, examples of what's there in the clinical study report. And so what you have is you have a full script, R script, with the package, with maybe example data, and then the syntax, which is calling the R functions in order to produce, for example, a demographic table, disposition table, AE table. And so organizations can copy everything that's there and just customize that. And
Mm.
so that's an example of a gallery, and I've collected the various galleries that are there. So clinical study report is one. You have graphs. You have other types of galleries that basically enable you to leverage what you know about R, and so it's really like everybody working together and sharing what they have developed.
Okay. And we've pulled this thread a little bit so far in the conversation. It was one of the first things I discovered when I was diving into R myself. Programming in R is really very, very different than programming in SAS. And there's a level of complexity that is inherent, I think, in programming in R, and that could be my naivete in saying it's hard, and everybody else is saying, "Oh, it's so easy." But it's really different, and I think if you've grown up accustomed to programming in SAS, it presents a level of difficulty to maneuver in R.
Yeah, I totally agree. I totally agree. And I'm a person that loves to program. You mentioned, several languages. It brought back the days of Fortran, and I definitely love that. I've been programming since high school days. So, and I'm very much used to, programming in SAS. I see that it's and of course, we pay for that. We pay for that ease of use, for the procedures, for the options that are there. And so when we're getting into R, basically you're going and and this is the advantages, disadvantages. R is a very, very powerful language, but because it's very powerful, it also requires a little bit more knowledge, understanding of how the syntax works. And one of the things that I quickly learned how to do when I was learning R, I did a lot of reverse engineering, because I was able to see, okay, with this syntax, I'm able to get this type of output. Why is that? How does that relate? How does it make sense? And so quickly, I was able to learn, understand, the syntax that's there for data frame options. For example, the first position being row condition, the second after the comma being column positions criteria. And so, but I agree, many things that can be very confusing when you're learning R, is that it may show you many ways of doing something similar. And so, you learn one way and then realize, oh, there's another package, and then this is the function that does something similar. Which way do you learn? And so I quickly learned, okay, let me focus on the most common packages, the tidyverse, and then exclude anything that's similar. That because I don't want to learn multiple ways of doing the same thing. I want to learn the best common way of doing things. And then the other thing is, I took a look, broke down a function into, okay, what are the requirements? Just like with any language, you have keywords. So keywords enable the software to do things, and then it has some expectations. And one of the first parameters in many of these R functions is the data frame, which is the data set. So you learn how to construct data frames, and sometimes we learn by making mistakes. And so what I was doing is I was constructing a data frame one way, and it was working fine until finally it didn't work. And then I was looking through the examples and trying to figure out why it didn't work, and I realized that method, that function for creating a data frame only worked in specific cases. And then I realized, oh, okay, so the other function, data dot frame, is more robust. It's the much better way to always create a data frame versus the other method that I was originally doing was the cbind, relied on a data frame being part of the construction process. So I quickly learned that, and I also learned to exclude noise. Noise, considering for example, matrix. I saw that, okay, matrix is an object that you can create in R, and it has its purpose and use. But if I'm strictly focusing on what I don't want to replicate in R, what I'd be doing in SAS, then I can really ignore matrix, at least for right now. and focus on the data frame. So that greatly helped with my learning and understanding process.
Okay. So I think obviously the mindset shift from programming in SAS to programming R presents a barrier of entry for teams. What else do you think is a barrier preventing wider adoption of R in pharmaceutical programming?
I think, it really it turns your world upside down. It requires patience. It requires detailed review of how or why these things are being done, uh, and that's where the R Studio works really well because everything that you create are objects, and objects have priorities. As I was trying to compare R with SAS, I'm always thinking, okay, tell me about the attributes of variables. And in R, you actually have, a few more options. You have what's called logical, so you have true or false. Um, and so that was nice to see. And you also have things like lists. So it extends the possibilities of what you can do with R. But initially, you always want to focus on the basic fundamentals. And another thing is I was trying to understand how the length of character variables work in R. And some of this stuff is not quite that easy to find or look up. Um, when I was doing and understanding R, because really, for people who've been in R for a long time, that length question didn't seem to be important to them. Why? Because there's no truncation issue that happens with R. And with SAS, I mean, we can have truncation anytime, and it's extremely important for character variables. On the R side, it was like, okay, it's no big deal. Well, why is it no big deal? Well, it's no big deal because R handles it. R handles it, quite well, meaning that there's no truncation issue. But at the very end, we still want a way to control the length of character variables because in our regulatory environment, we need to be able to do that. And so there are ways to do that. And the nice thing about the Farmerverse, so Farmerverse, you have a collaboration of these top sponsors, top CROs, and we're all working in with common goals and common issues. And so they'll develop packages to address these types of issues. So they see that, okay, Tidyverse is great, but I know here in our farmer industry, we're concerned about these setting of lengths for character variables. How best can we do that? So let's put together a roadmap. Let's put together the actual function, an example, and show programmers how to accomplish this because this is a requirement for what we have in our submission process. So I would say it is a bit of a long road. Could be steep. It's not like a shortcut. Going into R from SAS is not really a shortcut. It's really a long journey. But I think that you know we're able to see a lot of benefits from going this path because organizations have gone through this path. It's not like it's not possible. It is possible, but you just have to kind of see, okay, be aware of this and take this into consideration, and maybe taking a little bit longer than you may expect, but it's worth the journey.
Is there any differences in terms of infrastructure you need in a programming team to use R versus what you would need for SAS?
Yeah, I think part of the reason why I set up our guru is to make things easy. I don't really want to remember syntax. Remembering syntax is a real chore for me, and I developed SAS Savvy because I wanted to have a one place that I can look up the syntax. So if I want to know common options, for example, for proc compare, then I can go look that up. So what I've done with our guru is if I want to do any type of task, if I want to import data, a CSV file, or bring SAS in, then I take a look. I do a search. I can do navigation, or I can do a keyword search, and I can look up the actual syntax. That enables me to be very productive. And the nice thing about R is organizations have generally set up SharePoints with documentation. Initially, when you take a look at it, the documentation can be overwhelming, mainly because I've seen a lot of, and I put together documentation for again SAS macro programs, and so what you have over there is you have the macro name, and then you have a list of the parameters, and then you have a list of the options, and so forth. So, uh, and that's part of what you need to have as far as a good package. You need to have good documentation to support that. One of the worst things that you can do is spend all this time, resources, and developing an R package, and then have nobody use it. Nobody use it because they don't understand how to use it. It's too complex. You have some initial negative results from it. It's not doing what it's want to do. So you have all these negative things. But so you want to set up an infrastructure that really facilitates, mentoring, understanding of the syntax, and then correct usage of everything. So that's all very important.
What do you think handles clinical trial data better?
So I I I think both languages process data. I think as far as better, you know, what's going on with let's say for example FDA. Um, and I think that really sets the tone and how what people can really do. Because if FDA is doing it, then okay, you think okay, it is reliable type process, and they feel comfortable with it, and they're doing it now. That I haven't heard them do it before with SAS. So what are they doing with R? So they are using R for some more supporting submissions. So the submissions are still there as far as tables, listings, and graphs. That hasn't changed, RTF files, but they're using our Shiny to help better engage with the submission so they have a better understanding. They can do some querying. They can better understand the outcomes. They can confirm that. So that complements the regular submission very well. So they're definitely doing that. And organizations need to realize that and say, okay, if that helps in the submission process, organizations should be a little bit aware of what's going with Shiny, what they can do with that. Other things that FDA is doing things with it, again, to make things a little bit easier, what they normally would maybe do manually, and so which would be like comparison of the treatment groups, demographic comparison of the treatment groups. So again, tables are there, but maybe more of a dynamic way to as you have questions to take a look at, okay, what are the answers to those? So really facilitates that. And the other thing is um, detecting data issues. I think that what I'm seeing more done with R, and again, these things, some of these things also have been done with SAS, not so much the dashboards, but more along the reporting aspect and monitoring. But I think you see that because the ease of doing the data visualization, you see that maybe the clinical data is being processed and understood better with R, mainly because of the engagement that's going on. So those are some examples that I'm kind of seeing.
Okay, thank you. Okay, if we think about we're going to bring R into the real world, um, what would be some advice you would give to programming leaders who want to bring R into their organization and into their workflows?
Yeah, I would say ask, curiosity, ask a lot of questions, get your IT involved early, get your senior management involved early, have examples, have case studies, do your due diligence, do your research, um, and identify areas where you want to use R. And don't go into R just because, everyone else is doing it. Don't go into R just because FDA is doing it, but go into R with a full understanding. What are the risks associated with it, the pros, the cons, what type of timelines you have to work with, what exactly do you want to do? I've talked with several organizations. They may not want to use R to replace SAS. They may want to add on what they're already doing in SAS. They want to add on new things, new capabilities, value added with R, and which is the R Shiny. So they can continue using SAS for source and QC programming, and now they have R, which is specifically on top for Shiny apps, which is accessing the data that's already there. And so that's a really different way. Other organizations may want to bring in R for QC purpose. I think that there are many, again, go back to packages. So the nice thing about the packages, it should make our lives a little bit easier. We don't want to reinvent the wheel. I think the days of SaaS silos are numbered. For example, I would write sophisticated SaaS macro programs for data cutoff. But now with Farmverse, because you have collaboration, you have teams of sponsors, CROs, everything working together. There's already a package for data cutoff. And so, I would say in the future, organizations can take a look at what are packages available in Farmverse and see, okay, maybe we want to plan to bring that in. We don't need to have resources to develop our own within here. So I think, organizations need to take a look at what they want to do short term and long term, on what they want to do with R, and then kind of incorporate that, having everybody into the picture, and so that what you have is not necessarily replacement of SaaS, but maybe R and SaaS working, coexistence.
And there's, I think in the long term, since R is open source and there's no cost associated with it, and we all know that SaaS is just a very expensive system to be running. But there is a trade-off, I think, in having the ease of SaaS versus investing in the learning curve for R and creating another workflow or oversight system that you have to have in place, and how you're going to manage an open source system into the workflow.
Yep.
Can you give some examples of how you would recommend integrating R into a workflow?
Yeah. So for example, like some organizations have the SaaS LSAF. That is a programming environment that enables, of course, the development of SaaS, but also there are packages that are available within that type of environment. So they could actually write some R code, leveraging those packages, and so they could have seamless working together of SaaS and R. Some organizations, if they know enough about R and then they have some specific packages, then they want to leverage the features of those packages. While even SaaS, can do that, but they want to be able to use those. So I think organizations, they need to have the understanding and expertise of R in order to fully utilize it. So I think, taking a look at the big picture, it'll take some time for teams to understand how to use R. You have the tidyverse, so you can pretty much develop STTMs using tidyverse because all the functions are there, or you can use the Oak package to develop STTMs as well. So you have many options. You don't necessarily have to go with Farmverse. You can go with Tidyverse. You can do Source, or you can do QC. So there's many things. Or maybe you want to leave things the way they are in SaaS, and maybe you want to use R for data quality checks, or maybe for reporting purposes only. There's many things, and this is the nice thing. It really opens up a whole new world. You're not really restricted. So it's like, again, good and bad, where you have too many options to choose from. So you have to filter and say, okay, wait a minute. I don't want to do everything. I only want to do this. Can I do this? What is the best package in order to get this accomplished? And how can I reach this point? Because I don't want to, develop my own package or SaaS infrastructure to do this. So those are some guideline suggestions that I would say.
I'm just going to throw out an unexpected question here, but I spent a lot of my recent career thinking about automating SDTM and what that looks like, and is it, SDTM is a process. It's a necessary process, and it is a process, and it's not the most glamorous process, but most companies and groups have their system down for programming SDTM and then doing double programming of SDTM. And there's a lot to talk about. How do you automate that, or how do you streamline that? How do you see the packages in R that create SDTM as alleviating just some of that programming burden?
Yeah, good question. I think, again, if organizations have their method that has been thoroughly tested, is pretty sophisticated, various levels of automating STTMs, you don't need to obviously replace it with what's going on there with R. What R is bringing to the table, specifically as far as farm reverse, what I like to do is I like to think of it as pseudo standards. When CDIS came, it revolutionized this whole submission process, and people were like, why? And then if you take a closer look, people really understood, and it really streamlined it, mainly because standardization is the best and most optimum way of reviewing, because now you have complete consistency. You reduce the noise, reduce the variability, and so what happens is with the development of Oak and Admiral and Metacore and STTM checks, what you're seeing is a unique way. I'm thinking pseudo standards, meaning that okay, in SaaS, I always like to apply best practices. I always like to leverage metadata, and so again, that's along the lines of standardization. That's along the lines of automation. Why? Because you're producing results as efficient as possible, minimum, human error, human intervention. And so what's happening is you see a clinical data process flow from end to end, and you're seeing that these gaps are being, filled. And so organizations can use everything from end to end, or they can use a piece of that. um, Now, keep in mind there's a learning curve with using these types of things. So you want to incorporate that, and so with that learning curve, it you know take a closer look at exactly all the features of these packages, of these functions. It may or may not be as straightforward as you may think. Again, organizations are doing it because I think for the long haul, they want to see some standardization, consistency, and they want to reduce resources in order to generate this. We're all in a common state of common destinations, common issues, common challenges. We've been not like that before too with SaaS, but now with R, since it's open source, everybody can work together to do something about it, and then develop something once to be used by the community. And so it also addresses challenges as far as getting talent in our field as well. So
What do you think are some of the most common mistakes that companies make when they start their R journey?
yeah, I think you know too quick, too fast, not getting expert advice early on, um, thinking that you have to have all of the packages. I think not being selective of the packages, not going through the rigorous process of installation, operational qualifications, not being aware of what's going on in the industry, not learning from others' mistakes, um, because there's many things that what I found was when I was learning R, I thought, okay, I will spend 6 months, do a deep dive, and learn everything that I can about R. While I did that, I realized, oh, I'm still learning R, mainly because it's exciting, expanding, and I'm trying to see everything that I've been doing in SaaS, not just the basics, but a little bit more advanced. And with R, I've been talking about basics. I think tidyverse and farmverse, things that functions, packages that are there, but you can go beyond that. You can create your own functions. You can create your own packages. There's a whole programming language that's there. There's the R Shiny that's there. So I think some of the common mistakes is not completely knowing what you're getting yourself into, but I think asking all of the right questions. Try it out, see if it makes sense, see if you have the bandwidth, the time, maybe to incorporate maybe one of the studies. So I think that's what I did, and ask all these questions so that you learn from the experts who've already gone through this path, saying, okay, what works, what doesn't work, and then be cautious and move in the direction that's going to help you and your team and organization in the long haul.
And I think that's a really good point because it's very easy to be like, oh, R is new and R is going to take over the world. And well, I mean, R isn't new, but I mean, R is going to take over the pharmaceutical world and we need to jump in and go. And it's also very clear. It's important to understand why you want to use it and what you want to achieve by using it. So you know which pieces you're going to work, where you want to change your workflow or how you want to integrate R or what packages you need to bring in-house. I want to switch gears just for a couple seconds here and talk about the pros and cons of SaaS versus R. And we're going to wrap up with just where we think R is really going in the pharmaceutical industry. But just in terms of comparing SaaS and R, and I think we can do the cost one right away. We all know SaaS licenses are expensive and they only are becoming more so. And R is essentially free because it's open source, and I say essentially free. Obviously there's no cost, but there is a cost in the investment you have to make in the knowledge and skill gain for your programming teams.
Yeah, exactly. Yeah. And the thing is, there is, investment in order to make our uh, work in a validated environment, within the organization. So having the infrastructure that's there, and then using the expert advice of people who have actually gone through this process. So partnering with them and understanding how that works. But yeah, as I mentioned, I think the steep learning curve that's there, um, and have maybe have a committee within your organization to evaluate packages. There's several packages that are very very similar in functions, and what I'm doing is I'm usually comparing packages, and when I do the comparison, I take a look at, okay, what exactly am I getting out of this package? Um, and then I see, okay, how exactly is it easy to use? I want things make it easy as possible. So for example, proc compare, as I'm comparing and evaluating SAS and R, what are the packages that enable me to do the similar things as proc compare? So I take a look at that. And so keep in mind that, SAS has a specific way of doing things, and R is very more generic. And then, unless there's a package that helps facilitate that particular task, so you have to see, okay, don't just go into R because it's there, but really take a look at, okay, what specific task challenges are you planning to accomplish, and then how exactly you go about doing it. So, doing the research, and then doing the comparison and seeing the documentation that's there, and then building infrastructure to support, let's say, what you're going to be doing with R, so that your team can grow and expand, with that.
Is it correct to say that R, I may or may not use the right word, so if anybody in their audience is crying over the word choice I'm using, I'm sorry. But in my mind, I think of it as R is really excelling at data investigation and looking for what the data is telling you, and how you are, I guess, wrangling data is a term that I've been hearing a lot, but just dealing with your data. And that's like the basis of R and how it came into being. Maybe I'm making that up, but I always think of SaaS as very structured, and the reporting and what we do in the pharmaceutical industry is very structured. And so when we think about using R, we're taking something that was essentially, its strength is dealing with the unstructured and the investigation, and then looking at how we take that and transition it to a structured environment that we work
That
in.
Yeah, and I think that's a great way of putting it, because with that unstructured feeling, that you have with R, you have a lot of, robust, a lot of flexibility. And then now what we're trying to do is we're trying to put some structure, as you're saying, around it. And one of the terminology that's there with R, when I was starting to learn, is the concept of vectors. So you hear the term vectors everywhere when you learn about R, and realize, okay, vectors. I mean, that's good. That's the individual component of a specific variable, but I want to work in terms of data frames. And so that's where the structure, comes in. And some of these other data objects enable more more flexibility. And so that's where, the R is. It handles, like I mentioned, the list object, which is very foreign type in SAS. And but it has the real flexibility that's there. So you have little more structure in a regulatory type environment, because we want a fixed way We want to completely understand. We want to control. We want to reduce variability. So I think that's a good way to put that together.
Yeah, and just to close the loop on some of the pros and cons, I think we said SAS is easier to learn than R. So there's that. However, R is much more flexible. And then there's a con associated with that, I think, in taking that flexibility into our world. I want to wrap up and give you a chance to say what you want to say. So I'm going to tell you a comment that was left while we were talking, and ask you a question and let you see what you think. So the comment was, R is the new SAS, and that sounds really great. Our industry is not known for speed of adaptation, right? And so I think it's great as a programmer to say, oh, we should all move to R, and we're going to move to R, and we're going to be using R tomorrow. And that's just not the way we work in clinical research. So taking that comment and then thinking about where you think we will go in the next 5 to 10 years from a programming perspective.
Yeah, I think that's very interesting. Very somewhat relative comment. I would say, including myself, before 3 or 4 years ago, I would still say that okay, there's no really need to learn about R. But what I've been realizing is so many people has been saying so many good things about R. While there's some issues that you have to overcome and understand how R works, the fact is R is a force that you can't ignore anymore. With so many people saying good things and then so many things moving in the right direction, with the Farmiverse. And I'm still talking with people who know nothing about Farmiverse, and it's huge. It's this ecosystem that continues to grow, and it's going all in the right direction because we're in this field and we need to work everybody well together. And so now what I'm seeing there's options. There's options within the R world that you can evaluate, you can pick and choose. And so that really opens up, new doors, new opportunities. You're not restricted to just one language. Now you have R, but not only that, within R, you have all these different options that enable you to, have a jump start in the various things that you weren't able done before. And it's a very unique environment because you have tremendous collaboration that we've never seen before. And so you really can't ignore this, and organizations need to, take a look and see what they need to do with or make some type of decision with it.
Yeah, I think it is time to figure out what R can do for you and how you want to offer it. And if there's a way to extend what you're doing, I think data access, if you take it just outside of programming, data access remains a key component of clinical trials. Sponsors want to see their data, medical monitors want to see data, and is there some way to bring more access to data and more visualization for free? Once you get past the learning curve and the infrastructure, but how can you really extend what's happening and what you're seeing with your data? I think that's it. So I just want to say again, Sunil, thank you for the conversation and for bringing your expertise. I will include your contact details when I send some follow-up out from this webcast. So if anybody has any questions about working with R or wanting to know more about how to bring it into their organization, please reach out to Sunil. He will be your best source of information for that.
Oh, great. So thank you, Amanda. Thank you, audience, for your interest in this topic. Thank you very much.
Thank you, everyone.
Bye-bye.